Tonight.
I could only take 2 or 3 steps and I'd have to stop. It makes it hard to get around. You get real short of breath. I knew something else had to be done. I just can't do this anymore.
We realized that things were worrisome enough that we had to look into heart transplantation.
That was a shocker. That was a hard day for me.
An ABC 27 special presentation.
I felt a burning sensation below my neck and I felt a lump there. When I got the biopsy, it was determined that I had Hodgkin's lymphoma. You would have the normal chemotherapy side effects, but there's a small chance of developing a heart problem.
You just hope it's not you. Unfortunately, it was.
I don't care what you need to do to save my life.
Heart to Heart, sponsored by Penn State Health Milton S. Hershey Medical Center.
Good evening, I'm Deborah Pinkerton. As you know, February is American Heart Month. The goal is to raise awareness of heart disease and to get people to commit to a healthy lifestyle. Cardiovascular disease accounts for more than 800,000 deaths in the United States each year. About 8.5% are due to heart failure. Heart failure affects nearly 6 million people each year, and there are 670,000 new cases diagnosed annually. What does it mean to have heart failure, and how can it be treated? Well, you'll find out tonight. And if you have questions at home, Amy Kem, the host of Good Day PA, is here to tell you how to get them answered. Amy?
Thanks, Deborah. Specialists from Penn State Health Milton S. Hershey Medical Center are in the ABC 27 call center to answer your questions until 8 o'clock. Call the number on the bottom of your screen, or you can email your question during the show to questions@abc27.com. Cardiologist Edward Langford will answer your emails throughout tonight's show. All calls and emails are confidential, and I'll be back later in the show to share some of those questions with you. Deborah.
Thanks, Amy. A York County man was given a second chance. He was born with a heart disease that wasn't getting better. Here's John Mudge's journey.
That was a beautiful day.
John Mudge and his wife Teresa can't find enough words to describe each day. They're thankful.
Oh yes, I am living the dream now.
Each day is filled with endless possibilities for John. That wasn't the case when he was diagnosed with heart disease.
My twin sister, late 80s, early 90s, had got real sick, had got double pneumonia. And when they checked her, they found out that she had the heart disease, hypertrophic cardiomyopathy. And when she told her doctor she had a twin brother, he was interested in finding out if maybe I had the same thing. I went and got checked through him and did the echocardiogram and everything and found out that I did have it. But I was, at that time, non-symptomatic.
So John had a disease known as hypertrophic cardiomyopathy. It's a genetic disorder, but the heart starts out being fairly normal. And as people get older, and usually for some time between adolescence and early adulthood, the heart changes in various ways. In John's case, the major problem was that the heart couldn't relax appropriately, and it limited how much blood his heart could pump. He also had a heart rhythm abnormality that's common for any type of heart disease and common in heart failure called atrial fibrillation. And that in combination with hypertrophic cardiomyopathy makes people feel very poorly.
We had started going to different physicians to try to regulate the rhythm with just medications or whatever needed.
Initially, the medications worked. Then his health began declining.
It makes it hard to get around. You get real short of breath. You can't hardly breathe. I can remember some times where I could only take 2 or 3 steps and I'd have to stop. I knew something else had to be done. And I went and talked to my cardiologist and told him, I just can't do this anymore. I can't walk 100 yards on a slight incline before I had to stop, you know. And she sent me out to Hershey to see Dr. Bramer.
We did some studies to find out what his heart's function really is and how much it could do. And that's when we realized that things were worrisome enough that we had to look into heart transplantation.
So that was a shocker. That was a hard day for me. I was there by myself. And I left his office and called my wife on the way home.
He calls me and said he needed a transplant. And I went, a what? And he said, a heart transplant. And I went, oh, you must have misunderstood him. You know, that can't be.
And I said, yeah, that's what he said. We're going to work towards heart transplantation.
And when he came, then he got real quiet, and I told him, maybe it was.
It's a bittersweet thing getting a transplant like this, because you know what's going to happen for you to get it. So you don't really pray for it.
When we get to the point where we're looking at heart transplantation, it means we're concerned about somebody's prognosis in the coming year or two, and John was falling into that category.
Until a heart was available, every 4 to 6 weeks, John would spend days in the hospital.
He would come in repeatedly for us to measure how his heart's working with a procedure called a right heart catheterization. By doing that, we were able to add a few other medicines and then adjust his diuretics to get him in optimal condition. And then we would send him out for a little while and basically repeat the process to try to keep him as healthy as possible until that heart arrived.
I feel good for a while, you know, for a couple weeks.
He could do like one thing, but that would put him down for a while. You know, it took him days to recover from an activity, whatever it was.
During one of the hospital stays, John got what he calls the bittersweet news.
Dr. Bamer walked in about 7:30 in the morning, and when I saw him come in that early, I knew why he was there. My wife didn't really get it.
He asked me where I was going. I said, I'm going to work, and he said, "Man, you want to sit down here for a minute?" Still didn't dawn on me. John knew right away.
Then he sat down and told me that they had a heart. It was a 26-year-old male, and everything looked good. I thought it was going to be the perfect heart for me. And actually told me that he was a known drug user, and I had the right to refuse it if I wanted it.
And John looked at me and I said, "It's up to you. I'm with you, in or out, whatever you decide, I'm good with it. If you decide not to, that's fine. If you decide to, that's fine as well."
I decided that was the heart that God had gave me, and I was going to take it.
I said, "Okay, we're on."
You're joyous, you know. It's like, okay, the day's here, we're going to get this done, you know. And then probably 2 hours later, you get to the other side of it to where, okay, yeah, you know, a 26-year-old man has died, and he's gone, but you're going to live because of it. So that kind of brings you back to earth.
It's very common for patients to have remorse about the event that occurred in the donor. And I always try to encourage our patients that whatever happened had already happened. And this is actually a good thing for the family that's dealing with that tragic loss, to gain some glimmer of something good out of an event that otherwise is tragic.
The glimmer of something good was about to happen as preparations were made for the heart to arrive.
So when the heart is en route, John is already in the operating room and preparation are being made for his operation to start.
And we did get to go see the helicopter come bring it in. And that's probably my biggest breakdown moment.
In order to do the transplant, we connect the recipient, John in this case, to what's called the heart-lung machine, which does the function of the heart and the lungs. It bypasses the circulation through the heart and the lungs, which allows us to remove the diseased heart and implant the new heart.
And then the transformation began.
It's one of the most wonderful things we see, that this heart regains life and supports life, ultimately. It is remarkable.
He came in and said everything went well.
It took some time for John to gain his strength back, but he did.
There we go. That was perfect.
John's in a bowling league now, a favorite pastime he had to give up.
So I'm carrying a 138 average and trying to build it back up, trying to get that form back, but it takes a while. There it is.
It has taken a while for John to heal emotionally, too. John reached out to the donor family.
Oh, it's a great blessing. I've tried so many times to find the words to show my appreciation to the family. We wrote a letter to them.
I want each of you to know that not a day goes by without me thinking about you or your loved one. My wife, children, and I cannot express the heartache we still feel for your family.
They wrote me back. Her son had a young daughter.
He was a father to a beautiful daughter. He loved her more than anything. He would call her his girl. My son is missed every day, but knowing that his gift has saved a life makes it just a little bit easier. Hopefully someday we get to meet them. And, you know, when that day comes, if and when it does come, that, you know, she can see that, you know, it went to a wonderful person.
I still pray for the family every day and the daughter. That's one of my morning routines, to pray for them, that they're having a good life, and especially the daughter.
John truly hopes to meet the donor family someday. He says he was given a gift that he can never pay back. Now joining us is John's doctor, the director of the heart failure program at Penn State Health, Dr. John Boehmer. Thanks for being with us.
Well, thanks for having me.
Tell me, what is heart failure and what causes it?
So heart failure is what occurs when the heart is unable to pump enough blood, or it backs up in pressure in order to pump enough blood. It can create a lot of symptoms and disability in patients.
Well, I was going to say, what are some of the symptoms and how do you manage them?
The most common symptoms with heart failure have to do with either not enough blood being pumped or the backup of pressure from the heart, the blood that needs to be pumped. It can cause shortness of breath when the lungs are affected. It can cause the body to swell, or it can just cause fatigue and difficulty paying attention if you don't have enough blood flow to your brain.
And then the medication, you can usually use that to help some of these symptoms?
Well, the good news is we have many treatments for heart failure. In fact, during the course of my career, there have been no less than 10 new treatments, and many of them are life-saving. And we can not only help patients live longer, but help them feel better and make them more capable of doing more. How
common is heart transplant surgery?
Heart transplant is not terribly common, and it has to do with the fact that we don't have enough donors. There's only about 2,500 heart transplants performed in the United States annually.
And it took John a number of years before he did have a heart available.
Yes, depending on your blood type and size, it may take a while to find a heart that will fit you, and that's why we have such a critical need for heart donors. So when you do have the opportunity to make a decision to donate, such as when you get your license renewed, you need to think about that, because it's truly life-saving, and you also need to share that decision with your family so that they know what you would want to have done in such a circumstance.
Sure, and it certainly has made a huge difference for John.
It saves lives.
Dr. John Boehmer, thank you for being with us. Now, why don't we check in with Amy Kem in the call center? How's it going there, Amy?
It is busy, Deborah, really busy. Everybody's on the phone right now, if we can take a look. And you at home, you can give us a call right now. The number is 717-346-3333. And here to answer viewer questions tonight, we welcome nurse practitioner Jackie Boone. We have a viewer question for you right now, and that is, both of my grandparents on my father's side of the family had heart failure. Is it genetic?
There are several different reasons that a person may develop heart failure, and some of those certainly are genetic, but many of them are not. I would encourage anybody, if they have a strong family history of heart failure, talk about this with your healthcare provider. Let them know what your family history is. They may want to do some increased monitoring.
Very good. Thank you so much, Jackie, for being with us tonight. And if you have a question for a specialist, you can give us a call right now, or you can email your questions to questions@abc27.com. We'll be right back.
You're watching Heart to Heart on ABC 27, sponsored by Penn State Health Milton S. Hershey Medical Center.
Welcome back. A Lebanon County woman received some news she never expected to hear. At the time, Erin Coombe was 28 years old. Here's her journey.
We went to Bethany Beach in the middle of June of this year. Probably one of the first trips that we've taken in a very long time that we were really, really excited about.
A long-awaited trip to the beach for Erin and Chris Coombe.
Nice to sit back and relax, listen to the water, and have fun with some friends. And
it was just nice to get away and I guess have some sense of normalcy without doctor appointments being your normal.
Doctor's appointments became Erin's normal 3 years ago.
My husband and I were down visiting my parents in North Carolina for Christmas, and we were having a glass of wine over dinner, and I felt a burning sensation right around here below my neck, and I felt a lump there, and it wasn't there before, so I was a little curious as to what it was.
Definitely some concern, just because didn't know what was going on and was like, is everything okay? Like, we didn't know.
Went to the doctor when we came home, and he suggested I get some testing done, a biopsy, a CT scan also. And then when I got the biopsy, it was determined that I had Hodgkin's lymphoma.
I've never experienced cancer before, never had anybody that, obviously that close to me, diagnosed with cancer, so it was definitely a shock to me, to her.
A little bit of denial, but mostly shock and just kind of, why me? But then it was, all right, let's get done what we need to get done in order to beat this.
Doctors at a local hospital recommended chemotherapy.
One of the risks that they did say was that you know, you would have side effects, possibly hair loss, possibly nausea, fatigue, the normal chemotherapy side effects. But one that they did say was that, you know, one of the drugs would give you, there was a small chance of developing a heart problem. And the small chance was about 5%. At that time, I thought it would be okay. I wanted to be able just to treat this and be done with it.
With a 5% chance, you just hope it's not you. And then, unfortunately, it was. It was Erin.
Erin became part of that 5% statistic.
Fortunately, as a result of her chemotherapy, some of her agents were cardiotoxic. And basically what that means is that they damage the heart muscles.
So I saw a cardiologist, and he did put me on some medication just to help with that because he saw that it was the beginning of congestive heart failure.
While doctors monitored her heart, oncologists continued to treat the cancer.
Throughout 2015, I had to go through a few more different chemotherapies because previous ones didn't work, and unfortunately things got worse for my organs. My heart was failing more, my lungs were filling up with fluid, I was getting short of breath.
It was really tough for her to move around as far as walking. I'm short of breath all the time. And then she just wasn't feeling right in January.
Erin ended up in the emergency room. She was quickly taken to the Heart and Vascular Intensive Care Unit.
So this is Erin's initial x-ray on presentation when she presented with cardiogenic shock. And what you can see is a very big heart and a lot of fluid around her lung tissue.
I was diagnosed with Legionnaire's disease, which is a very rare form of pneumonia.
Her heart was already a little bit weakened. She had cardiomyopathy and heart failure before all of this from the chemotherapy. And so her heart was already not quite as strong as normal. Then this massive infection on top of it was just too much strain, and her body couldn't keep up with that.
Doctors knew Erin needed additional support.
The last thing I remember is the doctor saying that they would have to intubate me, and I said, I don't care what you need to do to save my life.
So she was put on ECMO, extracorporeal membrane oxygenation, and it's essentially a heart-lung bypass machine. So it takes over the function of the heart and the lungs for the body. It stabilizes the patient and provides us time to do other treatments to treat the underlying cause.
So they do a bunch of testing, see how the heart is. It's not really improving that much. So they do a CT scan to see how the cancer is. And they say the cancer is shrinking, which is beyond great news at this point. We're just looking for any kind of great news. So they did that, and they say that she's a candidate for the LVAD.
Her heart function just wasn't recovering enough to be able to support the rest of her body. So we started looking into long-term solutions if we weren't going to be able to get off the ECMO. So that's really, we started having the discussion about an LVAD, which is a left ventricular assist device.
It's a heart pump. It's usually placed in the lower chambers of the heart, and what it does, it sucks blood from the lower chamber, dumps it into the main blood vessel known as the aorta, and provides circulation to all of the body.
It would be attached to the outside of my body that I would have to have. It would be a controller, and it would have this information on it that I would have to monitor. It would be attached to 2 batteries. I would have to change the batteries frequently when they got lower and charge them.
And at this point, I'm like, all right, I've learned what an ECMO machine is and what an LVAD machine is. 2 weeks ago, I had no idea what either one of these things are. So they say, is this something you would want to do?
It's all thrown at you, but at the same time, if you want to live, you'll do what you need to do to live. And this was how I was going to live outside of a hospital and have, you know, good days, then I'll do it. It's fine.
I just wanted my wife back. We try and keep each other positive. I mean, yeah, we've had our bad days, but we just kind of look at it, hey, we'll get through this. I mean, yes, today's not such a great day, but tomorrow, we have tomorrow.
He's been a rock. He's been wonderful. He's stood by me the entire time. No questions asked. He does what, you know, any husband would do for his wife that's sick, without any questions.
Aaron had the LVAD implanted more than a year ago, and what a difference it has made.
I've been feeling more like myself and more able to do things on my own independently than have to rely on somebody.
She's been doing wonderful with it. Definitely some life changes that we've had to make and stuff like that, but for the most part, she's been wonderful.
It's nice to have a sense of normalcy again and to be able to get back into the swing of things and do things that I haven't done for a while, and it's nothing but positive.
And as you can see, Erin is doing so much better. Her cancer is in remission. The Heart and Vascular Institute and Cancer Institute continue to work closely together to monitor her situation. Now joining us is Erin's surgeon, Dr. Behzad Soleimani, the surgical director of heart transplant and mechanical circulatory support. As you can see, Erin is doing fantastic. This LVAD made a huge difference. You have one right here.
This is a replica of the pump that we implanted in Erin. It's a third-generation heart pump. It's been around for about 11 years, and more than 10,000 patients have benefited from this technology.
Now, the former Vice President, Dick Cheney, he had an LVAD, then he actually transitioned to a heart transplant. Is that common?
Yes, more than half patients that receive a heart transplant now are bridged to transplantation with one form or another of a heart pump. And this has been a major advance in treatment of advanced heart failure, because people who were too sick to wait for a heart transplant are now kept alive long enough for a suitable donor to become available. And that has had a major impact in overall survival of patients with advanced heart failure.
And talk to me about the future of LVADs.
So as you can see with this pump, electricity is delivered to it by way of a cable that's attached to it called a drive line. And right now the only way to deliver electricity to these pumps is to have the drive line breach the skin and be connected to a power supply. And that limits patients' abilities to bathe, to shower, or to swim. And we at Penn State Hershey are a pioneering institute in research into delivering electricity to these pumps in a wireless fashion. And we are hoping in not too distant the future we'll be able to produce pumps that are fully implantable and much more patient-friendly.
Oh, great. That's great news. Dr. Soleimani, thank you so much for being with us tonight. And let's check in the ABC 27 call center. Amy.
Well, hey there, Deborah. Folks, you still have a few minutes to get your questions in. The number to call is 717-346-3333. If the phone lines are busy, you can also opt to email your questions. That's questions@abc27.com. We have another viewer question now. Here is that question. Would only eating organic foods, maybe little or no red meat, and taking mineral substitutes like fish oil help me to avoid heart failure?
Well, maintaining a healthy lifestyle, including a healthy diet full of fresh vegetables and fruit, and doing exercise, things like that, can certainly help reduce your risk for developing heart disease, but it can't prevent it in all cases.
Very good. And now another viewer question about the story that we just saw. She said, I just watched the story on the woman who had chemotherapy and then she wound up with heart failure. I've been on chemotherapy and I've never heard of this happening. Do all types of chemotherapy have a chance of causing heart problems? That's a good question.
It is a great question. So not all chemotherapy drugs have this effect on the heart, and it's actually a very rare cause of heart failure. I think it would be important for people who have this concern to talk to your healthcare professional, touch base with them depending on the medications that you are on to see if this is a risk for you.
Very good. Thank you so much, Jackie, and thank you to the specialists who are taking the calls and emails tonight. Let's send it back to Deborah.
And thanks, Amy. Dr. Lawrence Sinaway, the director of the Penn State Heart and Vascular Institute, joins us right now. Tell me, what are the benefits for a heart patient coming to a teaching hospital like the Med Center?
Well, in academic academic health center has three missions. It's the clinical care, the education, and the research. And it's really that combination of activities that makes an academic health center special and provides the opportunity for patients to get the latest care and the cutting edge things that are going to really be the care tomorrow.
And tell me, is there any current research taking place that may change the future care of heart failure patients?
Well, so John Boehmer just presented a study at our national meeting in which they looked at over 10,000 patients and looked at sensors that were placed in a pacemaker inside the patient's chest. And they used the information from that pacemaker to try and predict when that person would have severe problems and would need to go to the emergency room. And they found that they were able to predict these events somewhere around a month before they actually occurred. So I think this is potentially a great breakthrough.
Okay, great. Dr. Sinoway, thank you for being here tonight. And we also want to thank you, our viewers, for sharing your stories and sending in your questions. If you would like more information or if you would like to schedule an appointment with Penn State Heart and Vascular Institute, call 717-531-4554 or visit online at hmc.pennstatehealth.org. Thanks for watching tonight. We wish you good health.